Welcome everyone to the latest installment of CADCA's Research into Action webinar series. I'm Nicole Alguero, an analyst on CADCA's evaluation and research team. The purpose of this webinar series is to introduce coalition members and substance misuse preventionists to current and relevant research being conducted in the substance use and community coalition fields. In today's webinar, we're delighted to have Veronica Chaitan join us for this very exciting presentation on findings from her recent article, Draining the Tobacco Swamps, Shaping the Built Environment to Reduce Tobacco Retailer Proximity to Residents in 30 Big U.S. Cities, published in Health in Place in 2022. Veronica is a senior data analyst at the center. Her current work includes the Advancing Science and Practice in the Retail Environment, ASPIRE, Tobacco Town project. Prevent Ed-led implementation grants focus on addressing the opioid epidemic in rural communities and analysis of local adult tobacco surveys and CDC's early hearing detection and intervention EHDI data. Her responsibilities include data collection, management and analysis, online survey development and administration, and preparing of findings for dissemination products. Her interests include data management, visualization, and translation. Now I'll turn it over to Veronica.
Thanks, Cole. Can you see my header slide okay? Awesome, thank you.
It looks all good.
Thanks everyone for joining us today. Like Nicole kind of gave a great introduction, I'm Veronica Chaitan, data analyst with the Center for Public Health System Science at the Brown School at Washington University in St. Louis. Today we'll be chatting about tobacco hotspots, taking a look at tobacco retailer density and resident to retailer proximity in 30 Aspire cities. Like Nicole mentioned, this is the paper that the work that we're going to discuss today has been published in. And to get started, I thought I could do a framing a little bit with a brief introduction into how or why we got into the work and who we are. So just kind of starting off with, why is tobacco control work so important today? Commercial tobacco use remains the leading cause of preventable disease, disability, and death in the United States. And as we know, there are many harmful effects, which include, and sadly are not limited to, cancer, heart disease, and lung disease. 11.5% of the US adult population reported being current smokers in 2021. That's about 28.3 million adults. The tobacco industry decreased its spending from $8.06 billion in 2021 to $8.01 billion in 2022. That's still an average of $8 billion being spent. So to frame it to this hour that we're spending together, that'll be about $1 million spent. And this is just on advertising and promotion and just on cigarettes. It doesn't include other areas of their spending and doesn't include other tobacco products. So who we are, the Aspire Center is a collaboration of 3 research institutions under a 5-year grant from the National Cancer Institute and the National Institutes of Health. There are 3 Aspire research projects, including Tobacco Town, which has produced a tobacco swamps dashboard that allows users to explore interactive maps of 30 Aspire cities, showing the possible impact of tobacco retail policies. So how tobacco retailer density and proximity to residents change, and whether policy implementation is equitable across demographics at the census tract level, all of which has led to the work with this paper. Aspire researchers work in partnership with the Community Advisory Board, which we commonly refer to as CAB, which comprises tobacco control program staff from 30 large US cities, representatives from several tobacco control organizations and agencies, and legal experts. Aspire's CAB partners help us to close the gap between research and practice by providing important input about their changing needs for evidence. In these 30 big cities, we have 27 big cities health coalition, 2 selected for regional representation, and 1 city that was selected for early adoption. To frame the cities a little bit more, 1 in 6 US adults live in one of these cities. And a little more context, across the 30 cities, there are 31 times more tobacco retailers than McDonald's restaurants, or 16 times more tobacco retailers than Starbucks. So what are tobacco hotspots? And you might have noticed that we use the term tobacco hotspots and tobacco swamps interchangeably. We started off calling it tobacco swamps, as you've seen in the title of the paper, but we've received some feedback from communities and practitioners, which we really appreciate. So we're now working towards changing our language. So what are these hotspots? Essentially areas with lots and lots of tobacco retailers. And we could define this in two ways, by density and by proximity. So you can define tobacco retailer density by area or by population. So a hotspot could be an area with a large number of tobacco retailers per square mile. You can define tobacco retailer proximity by the percentage of the residents living within walking distance or by residents or retailer distance. So a hotspot could be an area with a large percentage of the population living within a 10-minute walk of a tobacco retailer. And I think to keep in mind with these definitions is that proximity is not the same as density, and these can be considered two different ways of measuring tobacco retailer concentration. And in investigating the tobacco retailer concentration in the 30 Aspire cities, we had three goals. We wanted to take a look at the measures of tobacco retailer density and resident to retailer proximity across the 30 cities. Wanted to take a look at the impact of the retail policies on these tobacco retailer density and proximity. And then we also wanted to consider the importance of context for policy impact in this area. To do this, we simulated retail policies to predict their impact on tobacco retailer proximity and density. These three types of policies were chosen from place-based policies of interest among our CAP members. To represent the cap and winnow or license cap policy, we randomly removed tobacco sales from retailers until the total number fell below a predetermined cap. And some slides in the presentation will focus on the 50% license cap. For the retailer to retailer buffer, we randomly removed sales from retailers within buffer distance one by one until the minimum distance was achieved. And for the school to retailer buffer, we removed sales from retailers where the distance to the school fell below the threshold. For the slides, we'll take a look at mostly 600 meter or 2,000 feet buffers for both of these. These plots here show the relationships between two measures of proximity. Each is located on the y-axis, and then a single measure of retailer density located on each x-axis. We see that both measures of proximity are highly correlated with retailers per square kilometer. On the left, we see that as retailer density increases, so does the percentage of residents living within 1 kilometer for tobacco retailer. And on the right, inversely, we see that the median resident to retailer distance decreases as density increases. These plots here show the likely effects of 10 to 90% license caps, seen on the x-axis with the strength of the policy. The cities are ordered from the highest to lowest baseline percentage of residents within 1 kilometer for tobacco retailer. So if we look top to bottom and left to right, the curves will show the changes to the percentage of residents who live within 500 meters of a tobacco retailer with the red line, 1,000 meters with the green line, 1,500 with the blue, and 2,000 meters with the purple. The effect of random removal of tobacco retailers on retail proximity is nonlinear, especially for the shorter distances that we measured. Even removing 50% of the retailers in this fashion barely affects the proportion of residents who live in close proximity to a tobacco retailer. So if we take a look at the 500-meter line in red or the 1,000-meter line in green, only when we get to 70 to 80% of tobacco retail locations being removed do we begin to see a significant decrease in the percentage of residents living within 1,000 kilometers of a retailer across most of the cities. For cities that start out with higher percentages of residents in close proximity to retailers, for example, if we take a look in the upper row with New York City, Miami, and Philadelphia, decreases in percentages of residents living within 1,000 kilometers of a tobacco retailer, the green line, are much smaller. Larger decreases are found in cities with lower baseline percentages of residents living within 500 meters or 1,000 meters of a retailer, as seen in Memphis, San Diego, Kansas City, or other cities near the bottom of the figure. Here, we show the likely impact of a 50% license cap in the red bars, 600 meter or 2,000 feet retailer to retailer buffer in the green bars, and 600 meter or 2,000 feet school to retailer buffer in the blue bars. You can compare the results for proximity measure of percentage of residents within 1 kilometer of tobacco retailer on the left, with a density measure of retailers per square kilometer on the right, and cities are again ordered by baseline proximity. So in our simulations, the retailer to retailer buffers had little to no impact on residents' proximity to tobacco retailers. Comparing the green bars, we see on the right panel that a 600 meter retailer to retailer buffer eliminates over 50% of tobacco retailers, but on the left panel, the percentage of residents living within 1 kilometer of a retailer remains almost the same. Considering the density panel on the right again, we see that in all cities, density reductions after a 600-meter retailer-to-retailer buffer are greater than both the 50% license cap and a 600-meter school-to-retailer buffers. So if we just compare the green bars to both the red and the blue bars. However, if we take a look at single city comparisons, policy impact on residents' proximity to retailers and retailer density differs between the cities. For example, if we take a look at Miami, the second city highlighted in the upper left, in the left panel, none of the three policies result in substantial changes in the percentage of residents living within 1 kilometer of a tobacco retailer. But on the right, we see the retailers per square kilometer decrease by over 50% under the school to retailer buffer, the blue bar, and by over 75% under the retailer to retailer buffer in the green bar. In our work, and as you've just seen on the previous slide, we focus on 1,000 meters or residents within 1,000 meters proximity of a tobacco retailer or 1 kilometer, because it's a popular distance and representative of a 10-minute walk. But we've also considered these other distances to see what we could find. And what we've determined is all is not lost in terms of proximity and policy impact. School buffers do more drastically reduce the percentage of residents within 500 meters of a tobacco retailer, as we can see here in the red bars, and especially so in cities that start out with higher percentages of residents living close to the retailers. So those cities in the upper left. This figure illustrates the differential impact of policies and the importance of local context, which includes city size, baseline tobacco proximity, both measures as discussed thus far, and baseline tobacco retailer density. For example, we'll take a look at Baltimore in the top row and Portland, Oregon in the bottom row, and both are mid-sized at about 210 square kilometers and 376 square kilometers. Comparing the tobacco retailer density, Baltimore has a baseline retailer density of 5.8 retailers per square kilometer, while Portland has a baseline retailer density of about 1.66 retailers per square kilometer. When we compare the measures of proximity, Baltimore has a baseline median resident to retailer proximity of 0.24 kilometers, while Portland has a baseline of 0.39 kilometers. And for residents within 1 kilometer, 96% of Baltimore residents were within 1 kilometer of a tobacco retailer, while 84% of Portland residents were within 1 kilometer. In the maps, the red dots will represent retailers and the black dots represent residents. The heat map is red, where larger proportions of the residents reside within 1 kilometer of a tobacco retailer, and yellow to green in areas where the proportion is smaller. From the left to right for Baltimore in the top row, we see that the yellow areas increase the most under the school to retailer buffer policy in the rightmost column highlighted. However, we see little change in the heat maps for Portland under the same policy conditions in the bottom row. In both cities, the 50% licensing cap in the second column reduces density by about half. The median resident to retailer distance increases just 0.07 kilometers in Baltimore, but almost doubles that in Portland, about 0.12 kilometers. The 600-meter or 2,000 feet retailer to retailer buffer in the third column reduces the density the most of the three policies in the two cities, though the median resident to retailer distance in Portland under this policy increases less, from 0.39 to 0.55 kilometers, than in Baltimore, where it doubles from 0.24 to 0.51 kilometers. So that kind of talks through some of the results that we've found through our analyses and in the paper, and some key takeaways include reiterating again that proximity is not the same as density, and the impact of the policies on these two measures is different, and context is important. So again, if we consider the example from mid-sized Baltimore to mid-sized Portland as one case, we see that the baseline built environment for tobacco matters. And there are other factors that could be included, such as industry targeting of racially marginalized or economically disadvantaged populations. Maybe there are also historical reasons for higher retailer concentrations, such as redlining. Also to keep in mind as a takeaway is that policymakers should know that policies will affect the measures differently. And we can plan for this for gauging policy successes. And to keep in mind that maybe different measures may resonate differently across groups. So maybe you want to consider the context or the measure of proximity of retailers to schools for your area. Again, this is the paper that we talked on today. All of the work we've shown is due to the efforts by this team, and you can learn more about the work in this article. There's a QR code if you wanted to scan that. We also have access to it after the presentation. Next steps for our work are simulations with a focus on equity, because we know there are racial, ethnic, and economic disparities in tobacco retailer density and resident to retailer proximity, and that there are differential impacts across groups and communities from these retailer reduction policies. So a question to consider could be, how does a 600-meter school to retailer buffer affect low-income communities as compared to higher income communities in terms of tobacco retailer density? And then aside from traditional sociodemographics, there are structural measures of equity that we are looking into. One of these is the Social Vulnerability Index from the CDC, which includes 15 indicators of reflecting how ready communities are to cope with social and health disasters. And another one is the Social Capital Index, which has 19 components, including several measures of social and economic equity and civil and political participation. So this is my information and my colleague, Todd Combs. Some information for the Aspire Center and the Center for Public Health System Science at which we work. I wanted to say thank you so much for sharing your time today and joining us for this presentation. And I'll pause here for any questions.
Thank you, Veronica. Can you see my screen?
Yeah.
Okay. Thank you for your presentation. It's truly insightful work that you're doing. So I'll start the Q&A session and with a few questions of my own, and then we'll hear from our participants. So please start thinking and typing any questions you have for Veronica in the Q&A box. My first question is, have you started additional research on this topic?
Sure. So that equity work that we've talked about in one of the ending slides, that is one of the next steps that we're really excited to take on as the next step to this work. The results that we've kind of talked through this presentation so far are at the city level for the 30 cities that we work with. So the next step is looking at the sociodemographic and the structural equity indicators mentioned, and these are available at the census tract level. So we're hoping to really dive into how do the results kind of differ when you take into consideration these equity factors? What does it mean for different communities? We've run all the simulations related to these. So now we're just diving into the lots and lots of data that we got from running those simulations. We hope to conduct those analyses and maybe write a paper on it next year and publish that to share with folks.
Okay, yeah, and hopefully we can have you back here for that research too.
Sure.
And who have you presented your findings to, and who else would you want to reach?
Great question. So far, one of the first people we kind of take it to, aside from the researchers helping with the work, is the community advisory board that we mentioned. That's like a key part of Aspire project, because we love to work with them and get their input and take their feedback. So as we're moving through the process, we do share with these communities. These are their communities that we've done the work on, but we also want to make sure that our findings are helpful to them. Like, are we looking at the right policies? So we took their input to see which policies to even investigate. So they have been involved throughout the stages of the work, and they were the first that we took it to share the results when we were working on the paper. We've also presented to the Society for Research on Nicotine and Tobacco conference. So we were able to share with other practitioners and other researchers and folks who are really interested in this work to kind of say, like, here's what we're doing, learn more about what they're doing, and then get their thoughts on the work and next steps.
And how can coalitions and substance use preventionists in the field best use the findings from your research?
Really good question. So the work that we kind of presented in this presentation today is very tobacco control specific and specific to the 30 cities. But one of the things we like to encourage folks to do is maybe your city isn't exactly Baltimore, but maybe you're similar to Baltimore. And then you can take a look at what that context is in Baltimore, see what the likely impacts of the policy implementation could be in that city. So really, if you are not exactly represented, maybe find the closest community to you and take a look at what's going on there in the work. This screenshots that you've seen with the heat maps and such, this is from our Tobacco Swamps dashboard, which is available on our website. So you can explore the different policy levels. We highlighted 50% license cap, but we do have the results for like a 10% license cap, and then the other policies kind of mentioned in the presentation. So you can go ahead and explore a little more, see what's working or what might work or might not work for your area. That's again diving very specific into tobacco control retail policy, but then maybe bringing it out a little bit is that this work is very applicable to other areas aside from tobacco control. So maybe if you're working with something in the retail environment, you see how this potential retail policy could work in your area. Like you can see that different measures results in different policy results. So maybe consider what is the measure that you want to focus on, like what's right for your community. Because then the other takeaway is that context does matter. So you can look to see what the Gold Star is doing or what your neighbor is doing, but try to figure out like what might be best for your area and see what's going to work best for you telling your story and maybe convincing your policy folks of like what is going to be most helpful to them and helpful to you to get moving the work forward. And then we have other resources on the website, and then also take away that there are a lot of researchers interested in this. We love to help how we can. So please feel free to reach out with questions if anything comes up.
Thank you. That's great. And I think I'll touch base with you and get links to your website so I can provide them in the post-webinar email that will go out to all attendees. Yeah. And so now we're going to move over to participant questions. Feel free to keep typing any questions you have in the Q&A box. We'll get to as many as we can. All right. So first, will the slides from this presentation be available to view after this presentation? Yes, the slides and the whole recording will be available to view on our YouTube and website. I'll talk about this after the Q&A portion. I'll send a post-webinar email as well. Can you share your data sources?
Yeah. So I can give like a brief introduction to the data sources, and then when we share the link to the website, we do dive more into the data sources that we supply for this on the dashboard page. So the tobacco retail locations that we've identified are lists compiled by one of our partners, Stanford University. They've worked with the available licensing lists that they could have if that was unavailable for a city. They have purchased business data and then try to figure out who are the most likely tobacco retailers in those locations. So that's how we were able to identify the tobacco retailers across the 30 cities. For the residents, we've used a population simulation formula, which brings it down to the census tract level to kind of say who are the residents of this area, how it's likely made up. So we have these very realistic populations to provide for like considering how many or what proportion of the population live near a tobacco retailer. So we got those data from simulating that using the American Community Survey and the public use micro access data, if I got that right. So all those like geographic terms, trying to really make it realistic populations for those. For the schools, I believe we use some US national public and private schools for that. And I think those were the key things used in the simulations. If that kind of covers, and then there'll be like more details on the website. And if you'd like some more specifics on those, I'll be happy to answer that if you reach out via email or anything, if that did not satisfy the question.
Okay. Another question, any suggestions on implementing this in a state with preemption?
That is a great question. Think we have a lot of partners that we work with that maybe are experiencing preemption, who might be able to better address this question because we understand the challenges in working there. And I think we have some other better answers than the policies that I've shown simulated in these slides. I apologize, I can't dive much deeper into that myself, but if you would like to get connected with somebody who could maybe better answer these questions and give some more concrete suggestions on what maybe has been done in states with preemption, I'll be happy to follow up with that after the call, if that works. I'll take down the name of the person who asked the question, or if you want to follow up with me, I'll be happy to do that, Gabrielle.
Someone mentioned they're curious about the change in language from swamps to hotspots. Do you have anything to say about that?
Yeah, briefly to kind of touch on it, it's kind of negative connotations that could be taken with referring to an area as tobacco swamps. It had different meanings that were kind of shared with us and suggestions to move away from that language. And we tested around like a couple of different alternate terms that could be used, because tobacco swamps was used for a few years, and we've kind of landed on hotspots, another common term, maybe in geographic terms, to kind of describe that. So right now we're landing on hotspots, but maybe once we get more feedback from our community advisory board or our researchers, we might use a different language. But for now, just we really want to be cognizant of what is being shared with us by our partners. We love their input and their feedback, and we are not just going to say like, we were going to take into consideration and then move forward in language. And we appreciate that they spotted this, they share their opinions and their feelings and thoughts on this, and then give us suggestions.
Have you searched about the zoning policies already existing on those cities and how they have overcome the challenges of policy implementation?
Yes, that is research that we have already done. I will say the aspect of the tobacco swamps dashboard, it just gives you a snapshot of from when we were able to gather the data into time point. Like, here are the retailers here. Here is what could happen to those retailers if a policy were implemented at this level, at this time for that location. It does not take into account a zoning policy that may already be in place in that city. These are maybe future work that we're hoping to do, because at this point, what the Tobacco Swamps dashboard does. Another thing that we're working on in the Tobacco Town project mentioned for the Aspire Center is a model, an agent-based model that's actually putting in more data and making it more realistic with the geography, and then really trying to predict, okay, here's a city, here's all the information, here's where these residents live, where they work. How is a policy going to impact their access to these tobacco retailers? And at that stage, we're building the baseline for that model. And then I know in future stages, we're all really excited to explore, okay, again, similar to the dashboard, we're saying like at this time point, this is the existing retailers, and then here's what could happen. But then we want to consider, does that city already have a policy in place? So these are all future steps that we would like to consider, but at this time, we have not implemented it into the dashboard. And we also work with our CAB, I will share, to figure out what's going on in your work. What have you done in your work? What policies have you implemented, hope to implement, or maybe are not able to implement that you were hoping to implement? So we've done interviews with them, we've done surveys, maybe some questions to this, maybe some answers to this question could be found on the Aspire website when you find out, because we do provide the results of these interviews with them. So there might be some in-depth responses to some of these there.
Did you look at the impact and comparison of communities that have a licensing policy versus communities that did not have a licensing policy?
Yeah, similar to the answer where we know that some of the communities might already have a policy in place, but at this time we did not take that into consideration. We just did a snapshot of the retailers and then what a likely impact of a policy could be. That can answer that.
Do you see your research being expanded into rural simulations?
Yes, that is a great question and something we would love to explore. At this time, I think for the Tobacco Swamps dashboard, just because the focus is the 30 city, we're excited to kind of see how these are in these 30 and future simulations, whether through the dashboard or maybe through the model. We would be really interested in expanding to rural areas and like seeing what information we can gather and then how realistic we can make those simulations. So at this time, nothing currently being explored to this level, but it is definitely in our hopes to do such an expansion one day.
What made you? Oh, go ahead.
Could I just add one more to that, just because I'm thinking about it, like this is what we have kind of produced, but if a rural area is able to say like, here are the location of all our retailers, I know the school information could be public for some areas, so that is accessible. If the data is there and you can just check the distance, see how the removal are, because we've described how we kind of took some away. You know, if not necessarily us doing this research, it's definitely applicable to somebody else who's trying to like dive into this and maybe use this as a template and then apply that to a more rural area. So I do want to say, like, even if we don't get into it, it's definitely like something somebody else can kind of explore.
Also kind of ties in with a question, what current advocacy plans are in place with this data?
That is a great question. I don't have the full spectrum of like what is going on or what has recently been done or might be done, but I do know that the Aspire Center works towards creating tools that our 30 cap cities could use. So that might include like one-pager sheets. I know there are tobacco swamps one-pagers. There are, I believe, tobacco sales one-pagers. So basically we try to provide this information to folks and then they kind of use it in planned way or like an as needed way, because we know the tobacco control world and then the policy landscape, something is always happening, something's always popping up, and you want to be prepared for that. So they have access to the website as you do, but they're able to just like pull that information and then use it as needed in their own work. So maybe something's coming up in local policy and they want to show like, this is possible results of something, or this is a snapshot of what's going on in our area right now. I would say off the top of my head, like that is something that does tend to happen. And then they utilize this information like as needed as things pop up.
Someone asked if you have recommendations of which policy makes the most impact.
Great question. I'm just looking over to my Baltimore Portland slide to see where I think we talked about, even on the bar charts, like depending on what kind of impact are you trying to make, because we see that depending on the policy, you can have more impact on proximity, you can have different impact on density. And then also just taking a look again at Baltimore and Portland, you see that level of impact kind of changes depending on your area, depending on the policy again. So I think if we take Baltimore as an example, a school to retailer buffer is going to have the largest impact and at the level of the 600 meter, because we do also compare it to a 300 meter. So you can take a look on the website. So I would say to answer that question, maybe you do take a look at the tobacco swamps dashboard or any of the other sheets I mentioned that are tailored to the city. And up to 30 cities, is there one that maybe is most similar to your location? And then pick that location and then move through the policies to kind of see what the results are. And I think that would be the best way to figure out like what might be the best policy for your location based on the similar location. Because again, I'll go back to the takeaway that context is important. And I don't want to speak to one policy being very important for your area, but maybe your context means something else is going to have a bigger impact for you.
And how would you suggest we present some of this information in a social justice framework? For instance, do you have research supporting greater outlet density in proportion to minority communities, etc.? So is this something that your future research could, yeah. Mm-hmm.
That's a great question. I think maybe just if I take the snapshot of like what we presented at the city level for this work, I think you could frame what's going on in your city. And then we didn't show this because the paper focused on these simulations at the city level, but the tobacco swamps dashboard does currently have an aspect that looks at the socio-demographic makeup at the census tract level. So you are kind of able to see amongst the lower levels of something, how does that compare to the impact at the higher levels? And this was something that we kind of did for the dashboard. And then the analyses that I described maybe go a step further, taking a look at other equity indicators. But we do have a look at this equity work for sociodemographics on the website. So I'd say if you want to explore that a little bit and then see the differences that are showing there. Again, if you want to pick a similar community, see what's going on if it's not the exact same community. And then, yeah, Nicole pointed out, like we're also diving into this a little bit further to see what we can find out from these traditional equity indicators to maybe some more structural indicators to see what's going on there. And then that future research maybe can also help answer this question. But we do have a snapshot of sociodemographic and equity results on the dashboard on the website that I would point you to.
And then our final question, what made you want to research this topic in the first place?
That's a great question. And I'll take it back to the intro slide that kind of talks about like why we're still in this, just because we have made we have made progress, but as you all have seen, anytime you step into a store that sells tobacco products, that the work is ongoing. The work keeps you on your toes because there's always a new product that's coming out. There's always a way to combat the policies that are in place. So there's just so many levels to tobacco control. This is just one aspect that we're focusing on the tobacco retail landscape, because it is an area that we can have some policies, if you can implement policies in local governmental agencies, or just local agencies can take more control rather than just waiting for the national level to increase the policy. Like, you can have a local policy, and if you put it in place, it might allow you to control the implementation and the enforcement and make sure changes are happening in your community. It is an exciting world to just kind of keep doing as much as we can to help support the practitioners and the policymakers and all the folks who need things to keep progressing, to keep combating the tobacco industry's work too. So just, it's an active space that we're all, those who work on it, the folks that put in the paper, we're all just trying to do what we can to really help and support our colleagues in this work.
Thank you so much for all your insightful answers and your recommendations to resources as well. I'm excited to share that with everyone after the webinar.
Thank you for coordinating all this.
Great. So to wrap up, I want to mention that the next Research in Action webinar is scheduled for February 27th. This one is actually rescheduled from December. So mark your calendars and look out for the registration link in February after the forum event. Also, the 2024 Annual Survey of Coalitions will open very soon. We'll provide more information through email, social media, and on the CADCO website in the coming weeks. As mentioned earlier, I'll send a follow-up email with the presentation recording, a copy of the slides, the article link, and a short evaluation. I'll also include some of the resources Veronica mentioned, especially links to the website. So please fill out the evaluation. If you would like a letter of participation, you can view and download it from the thank you page at the end of the survey. You must fill out an evaluation to get the letter, and you must download it right after you fill out the evaluation, because you will not be able to go back to the thank you page later. Thank you, Veronica, for the wonderful presentation and great work you're doing in the field. And thank you to all webinar participants for your comments and questions. We enjoyed having you, and we'll see you next time.
Thanks everyone for joining.